Hello everyone, it's the 5-Foot Doctor. It's been a while, but it's a new year, so we are turning a new leaf. I know we always say this every year, but we're going to do better and we're planning on it. All right, so today we're going to be talking about heel pain. If you have 2 feet, if you've ever walked, you know that heel pain is something that most people have all the time. It just hurts and hurts and hurts. Some people complain about it when they get up first thing in the morning. Some people complain about it after they've been walking for a long time. And some people complain about it, maybe it's hurting in the back of their shoes or in their heels or something like that. The point is, everyone at some point has had heel pain. Some of the presentations that you would see heel pain present as is it starts to hurt gradually after they've been walking on it for a long time, they've been moving, and it just gets worse and worse and worse and worse. And so other people may even complain that it's the first step in the morning. As soon as they step down, it just hurts tremendously and they cannot take it. Some other people, it's the back of their heel. When they wear a shoe, there's a bump there and it just causes them pain, and they can't really wear any closed-toed shoes or any shoes that has any strapping or backing or anything of that nature on that area. Now you may be wondering, am I likely to develop heel pain? What could predispose me to having heel pain? Is there something that I'm doing? Is there something that I can do? Is there something that I'm wearing? Or is there just something about my lifestyle that may be causing me to have heel pain? Well, a lot of the times people who have heel pain are usually perhaps in their, maybe 20s to 60s. Now, being that I am a foot doctor, I have seen it all across the board. I've seen kids have heel pain, which in that situation is called Sever's disease. And that's something we'll talk about at a later time in a later video. Or if you want to know more about that, please leave a comment down and ask me a question of if your kids have heel pain, is that normal and stuff like that. And we'll make a video about it. So just leave a comment down below. Other things that may present could be, obesity. So if you're a little overweight, you definitely have more pressure, because you have to believe, you have to understand, the foot is taking a lot of the weight of the entire body. So if you're putting so much weight on it, due to obesity and things like that, then definitely sometimes that could cause heel pain as well. If you have some sort of arthritis in your foot, in your ankle, in your toes, that will definitely cause some heel pain. It could cause some heel pain, but most of the time, it'll cause pain over the foot as well as the heel. So if you have any history of arthritis, definitely, let your doctor know, let your physician know, and then they'll check it out and see if your arthritis is most likely related to the heel pain. If you're doing a lot of standing or walking, so perhaps your job just requires you to spend a lot of time walking, that is definitely something that you want to consider that may be causing heel pain, because that's when we start to figure out how can we modify the activities that you're doing that'll help you get some relief. For our athletes or people who are active, if you're doing a lot of jumping, a lot of impact activity, a lot of sporting activity, or you're coming down from high spots, that could also likely cause heel pain. All right, so now we've talked about heel pain, we've talked about how it presents, we've talked about some of the people who could get heel pain. Well, what are some of the causes that you may see are causing heel pain? Well, one of the most common causes of heel pain is plantar fasciitis. So plantar fasciitis is an inflammation of the plantar fascia. The plantar fascia is a band of tissue that runs from the heel and extends all the way to the metatarsal phalangeal joints. Now, this happens a lot of the times because there's tightness in that band. When there's tightness in that band, it starts to pull on the bone of the heel. That big heel bone starts to pull, and that's when you see people come in and say they have heel spurs. So, to digress a little bit, heel spurs are just an indication that there is tightness in the band and there's traction or pull. So if I held your finger like this for about a month and I didn't do anything, I didn't relieve it or anything like that, when we take an x-ray after a month, we would see that you could have spurs or bony growth along the area of pull. So what that means is that when you have the plantar fascia that's attaching to the heel and it's pulling, that causes that spur to grow. Now, I've seen spurs as big as fish hooks, dear. It's been hilarious to kind of talk about. Most of the time, heel spurs don't hurt. They're actually an incidental finding. However, when you see a heel spur, it tells us that there is tightness, there is pull, there's traction of the plantar fascia, and we need to release that tension. One of the most common ways that you know you have plantar fasciitis, we have what we call postkinetic dyskinesia. That's a big word that essentially just means pain in your first step in the morning, or pain after you've been sitting for a while or resting and you go to move and you have this sharp, painful sensation on your heel. It's not 100% that is plantar fasciitis, but that is usually one of the first things we ask, and it'll really lead us down the path of diagnosing if you have plantar fasciitis. Another potential cause of pain is Achilles tendonitis. So Achilles is that big tendon. It's actually the strongest tendon in the body that attaches to the back of our heel. And if there's tightness in that tendon, just like every other tissue in our body, and we don't stretch it enough, guess what? It could become tight and also cause a heel spur. It's the same heel spur, just in a different position. So again, when we take an x-ray of you and we look and we see that there is a heel spur, it just gives us and tells us a story that there's tightness in that tendon currently. Another cause is bursitis. A bursa is a fluid-filled sac of tissue that usually cushions the tendon from the bone. And so if you have a bursa that has fluid in it and then becomes inflamed, it becomes red, hot, swollen, and just tender, then that'll cause pain. There are bursas that reside all over our body, but in the foot specifically, the bursa is right between the Achilles and the heel bone. Haglund's deformity. That is another cause of heel pain. A Haglund's deformity is a big bump that's seen on the top area of the heel. So some people, when they look at your foot right now, pause this video, take your shoe off, and look behind your heel. If you've been having heel pain and you've been wondering, why does this hurt? And you also have maybe a bump behind your heel, most likely that's a Haglund's deformity. And that is important to know because a lot of the times, other than cushioning the area, putting some padding between your foot and your shoes, there's not a lot that we can sometimes do to help relieve the pain short of surgery. But again, it doesn't mean that there are no conservative, non-surgical ways to treat it. It just means that that bump is not going to go away on its own. We're just going to have to manage it and put a Band-Aid over it. Rhetorical Band-Aid, it could be a big padding, a cushioning. There are a variety of things that I would do in the office that kind of help with padding that area off. Like I had mentioned earlier, Sever's disease. Now, Sever's disease is an inflammation of the growth plate of the heel bone in kids or patients that are still developing. And that usually would happen with kids that are very active. They would have pain a lot of the times. They would wake up in the night sometimes after they've had an active day and just complain of nagging pain. Alternatively, we want to make sure that there is no fracture or growth plate injury. So even when a kid is complaining of heel pain, we have to do a variety of tests and imaging to make sure that we're not missing anything. And a stress fracture. A stress fracture are micro tears or micro breaks within the bone. And so in the bone, you have the cortical bone, which is the outer shell of the bone, and you have the trabeculus bone or the cancellous bone, which is the inside part that kind of looks like a sponge. And so when we have a fracture either within that little spongy area or just a little crack in some part of the cortical bone, then that could be deemed a stress fracture. Stress fractures happen when you've just been active, just repeating your daily movement. So repetitive micro motion could cause a stress fracture. And by the way, you can have a stress fracture anywhere in the body. So we've talked about what heel pain is. We've talked about some of the things that causes it. We've talked about how it could present. Well, what are some of the treatments that you can do to help with heel pain? Well, one of the first things that I say is stretching. We've said the most common cause of heel pain is plantar fasciitis, and which is inflammation of the plantar fascia, and a lot of the times because it's tight. So what you can do is stretch your plantar fascia. There's several exercises that we'll put up, and you can see how these exercises can help to help stretch that plantar fascia. It stretches it, and I'll also put a picture somewhere that you can see some of the stretches and exercises that you can do. A video will also be linked so you can see me demonstrating exactly how you're stretching. You want to make sure that you're stretching the bottom of your foot. You also want to make sure that you are stretching your Achilles tendon appropriately. The Achilles tendon, again, being the biggest tendon in the body, needs adequate amount of stretch. So we have those stretches that helps you stretch it, and making sure that you're stretching both muscles. Because there are two muscles that makes the Achilles tendon, the gastrocnemius muscle and the soleus muscle. If we stretch those appropriately, then that will really give you a nice stretch to the Achilles tendon and help you prevent that heel pain. Another thing that I like to recommend is icing the area. I like to say get your bottle of water, put it in the freezer, that's your foot bottle. When you're ready, you take that and you roll your heel on that bottle. It does two things. The ice is hard and so helps stretch that plantar fascia as much as possible. The ice is cold and so helps with the inflammation, that burning, stinging pain. It helps calm it down. It helps make it feel better. Footwear modification. So footwear modification means you want to make sure that when you're wearing your shoes, they're nice and sturdy. If you check on my Instagram, I have some videos, or even my TikTok, I have a video showing how to pick your shoes or what you should not have in your shoes. Even on my YouTube, I believe that there's some videos that I may link somewhere up here that shows you some of the things that you should pick when you should look for when you're trying to pick a shoe. So footwear modification, you want something that's sturdy. You don't want anything that could bend like a pancake and flatten out. Sometimes you have those over-the-counter orthotics, which in my opinion as a foot doctor, only a few of them are great and helps you with heel pain. But try as many as you want and see if you get some relief with them. And then NSAIDs. So NSAIDs are like oral anti-inflammatory medications like ibuprofen, Motrin, Tylenol, Aleve, Advil, all of those things. You can take those. Make sure that you are following the instruction on the back of the bottle, and also speak to your doctor before you start taking any medication, because they may have adverse effects when you're taking with other medications in your box of medications. Well, we've talked about a lot of the things. So we've talked about presentation, we've talked about symptoms, we've talked about causes, we've talked about the home treatment. So let's talk about when you need to see a doctor. You need to see a doctor if you have tried to use over-the-counter medications, you've tried rest, shoe modification, you've iced the area, you've stretched the area, and you've done all these treatments for about 2 weeks. If you've done all these treatments for about 2 weeks and you see no improvement, it's time to give your doctor a call. They will give you advanced imaging. They'll give you other options that will evaluate you and make sure that we're not missing something like a fracture, a crack, a tumor, or something even much worse that we don't know of. So, all in all, I hope that you've learned a bit about heel pain. If you have any further questions, again, please leave a comment down below. I'd really appreciate it. If you want to send me a DM, my name is The Fly Foot Doctor on Instagram. You can find me on there. Please follow and then send me a DM. If it's something I'm able to help you with or answer your question, I'll be sure to answer your question. On my TikTok, I make cute little videos that kind of talk about some of these things. So if you have any questions about that, you can hit me up on TikTok as well. Again, it's The Fly Foot Doctor. But for DMs, I prefer Instagram. It's much more user-friendly for me to answer DMs. Thank you once again for following, and thank you once again for subscribing and sticking with me to the end of this video. I really appreciate you guys. Thank you for all this time. If you have any questions or comments, leave it down below. Share this video, like, subscribe, and hopefully I helped you. And if you have any other foot questions or any other videos that you'd like me to make, please let me know down below and I'll be sure to get it to you. Till next time, it's The Fly Foot Doctor. Bye.